Dr. C.H. Asrani, an esteemed speaker at the 30th VPSSMS. Dr. C.H. Asrani, sir, a diplomate of the National Board in Family Medicine, is a highly accomplished medical professional with over 47 years of clinical experience. His multifaceted expertise spans clinical practice, the training of medical and insurance professionals over 16 plus years, and extensive experience in the insurance sector, which is over 25 plus years. Asrani sir contributions to medical education are unparalleled, having conducted over 1,500 training sessions for doctors and insurance professionals across diverse topics, including acute and chronic disease management, wellness, and insurance fraud prevention. Renowned for his insights into consumer behavior and medical intelligence, Sir is also a pioneer in leveraging digital platforms to deliver continuing medical education webinars via Inches Academy, reaching thousands of professionals globally. Fluent in 6 languages and a passionate advocate for adopting new technologies, he combines exceptional communication skills with a dedication to advancing knowledge in health and insurance sectors. Sir's vast academic portfolio includes qualifications in family medicines, acupuncture, forensic medicine, medico-legal systems, and blockchain technology. His global impact includes lectures and training at the international forums in Dubai, Singapore, Sri Lanka, and Malaysia, making him a highly sought-after speaker in both healthcare and insurance industries. So let us welcome Sir to share his insights today.
So I have been told to be brief, which I am always brief, so I'll be briefer now. See, when we start practice and when you all are going to start practice, which patient do I need? A patient who has a noticeable symptom, a symptom that is troubling him or her. I don't want a patient with silent symptom because he'll never come to me. In 47 years of practice, the only regular patient, you tell them come in 6 weeks, they are there in 6 weeks, are respiratory cases. Sinusitis, polyps, adenoids, asthma, bronchitis. So that is why the theme today of respiratory ailments. Please put off the lights. Next. Next slide, please. Respiratory diseases are the most common acute and chronic conditions that a patient suffers from. So much so that now they have become third cause of death after hypertension, diabetes, and cancer. They occur in all societies regardless of their socio-economic status, all age groups, and all sectors of population. They are more risky in patients who are immunocompromised. The overall incidence has increased in recent decades due to a rapid increase in factors such as, next, population growth, increasing industrialization, increasing vehicles. Everybody today talks of pollution. Please stay there only. I will tell you next. High level of indoor pollution, smoking, and low immunity. We all have low immunity. We fall sick very often, and that is the reason these patients' numbers will keep increasing. Next. Upper respiratory tract, nose, sinuses, turbinates, airway diseases. Next. Parenchymal diseases, interstitium, everything will give symptoms, and this patient will need attention, and many conditions have no cure, and that is where you step in. It's not a cure that, okay, 5-10 days antibiotics and then you get cured. Next. Upper respiratory tract. The passages from where we breathe, the noxious air. We have seen COVID, we have seen influenza A, influenza B, and now we are talking of more and more upcoming viruses and believe me, 99% will hit the respiratory system. That means symptoms, that means patient coming to the clinic. The upper way not only provides a passage for air to be breathed in, but also heats, humidifies and filters the air, and that filtration is gone wrong. Common problems: rhinitis, pharyngitis, laryngitis. I know the minute I am naming the disease, each one of you is thinking of a remedy. Sinusitis, tonsillitis, adenoids, polyps. Adenoids, wow, it should give you a smile when a patient comes. We'll do an X-ray now. We'll repeat X-ray in 6 months. So you have 6 months window to treat that patient. Sinuses, polyps, 1 year window because they want to avoid surgery. Next. Examine the patient. Look at the inflated turbinates, hypertrophy turbinates. Takes at least 6 to 9 months of non-surgical therapy. Look at sinuses. You have to diagnose a sinus. The commonest cause of chronic headache after a refractory error is a sinus, not a brain tumor. Next. Next. And then lower respiratory tract, pneumonias, tuberculosis, interstitial lung diseases. Everything is severely symptomatic. Patients are breathless on slightest exertion and they need support. Next. Next. I have been very brief, but then understand one thing. If you or any practitioner, homeopath or allopath, does not master respiratory tract, he might as well think of retiring.
Gift ready. Thank you, Dr. Asrani, for a very lucid talk. Really appreciate.